Nursing theories are used to define and explain the profession of nursing. These theories have helped to further advance nursing by improving patient care and outcomes. Theories Neuman systems model is defined as a unique systems-based perspective that provides a unifying focus for approaching a wide range of nursing concerns. This model can be applied to all areas of nursing practice, including research, education, and administration. The nursing paradigm concepts included in this model are human beings, environment, health, and nursing, and these will be elaborated on in additional slides. Human beings in this model refers to clients or client systems. Clients can be an individual, family, group, community, or social issue. The figure on the right is a diagram of the client or client system. The basic structure is located in the middle circle or the core. Basic survival factors, as well as the 5 client system variables that are necessary for stability, are located in this basic structure. The 5 variables are physiological, psychological, sociocultural, developmental, and spiritual. The outer broken circle of the diagram is the flexible line of defense for the client. The flexible line of defense is a protective buffer for the normal line of defense. The normal line of defense is depicted in the diagram as the first solid concentric line just inside the flexible line of defense and is specific to the current state of the client. This line is influenced by coping patterns, lifestyle factors, developmental and spiritual factors, cultural experiences, and system variables. The lines can change over time based on stressors, experiences, and wellness levels. The lines of resistance are the innermost concentric broken circles in the diagram and are necessary to protect the variables and elements located in the inner core. These lines of resistance are used when a stressor or situation gets past the normal line of defense. Each of these aspects of the client structure have a very specific and important role in order for the client, human being, or system to function properly. The environment is all the internal and external factors around the client or system. It is made up of stressors, and these can be both positive or negative depending on the situation. Internal environment is made up of intrapersonal stressors or what is going on inside the client, for example, emotions. External environment is made up of intrapersonal and extrapersonal stressors. Interpersonal stressors occurs between the client and another individual, group, or system. An example of this would be a role expectation of a family member. Extrapersonal stressors occurs outside of the client. An example of this would be a healthcare or social policy. The health concept of the Neuman systems theory deals with the wellness continuum as seen in Figure 3. Energy is continuously flowing between the client and the environment, and depending on whether more energy is being created or used determines how the client reacts to a stressor. The client is in a state of wellness when more energy is being created than used, and a state of illness when more is being used than created. The nursing part of this model is what nursing does to keep the client stable or provide interventions to return to a state of wellness. This is achieved by using a nursing care plan of a diagnosis, a goal, and outcome, and then interventions are implemented to meet those outcomes. There are 3 categories of interventions: primary, secondary, and tertiary. Primary prevention strengthens the client before a stressor occurs and strengthens the flexible line of defense. An example of this would be health promotion. Secondary occurs immediately after a stressor or event, and tertiary intervention occurs after immediate care has been rendered and includes interventions to help the client return to a stable state. This model is useful to nursing practice, especially in the case study approach. Ross and Bourbonnais wrote about their use of Neuman's model with a case study involving a patient recovering from a recent myocardial infarction. The public health nurse used the concepts of client, environment, health, and nursing to assess the patient for any stressors. Then, along with the client and his wife, the nurse was able to develop an appropriate plan of care to help the client make lifestyle changes following his recent myocardial infarction. The client's goals were to be free of chest pain, gradual increase of activity tolerance, to stop smoking, to reach his ideal body weight, and develop a fulfilling life after retirement. These goals required specific intervention strategies, as the client had already begun to fall back into his old habits post-discharge from the hospital prior to the in-home visit. These interventions focused on re-education, motivation, behavior modification, progressive goal setting, reality orientation, and use of resources. The author used Neuman's theory to provide an all-encompassing assessment and develop of a specific plan of care to ensure the client was able to lead a fulfilling life post-retirement and post-myocardial infarction. Edelman found this model helpful when working as a diabetic educator. She used the systematic approach to assisting a client who had maintained good blood glucose control for 2 years, and then suddenly his glucose levels markedly increased and he gained 26 pounds. Edelman used Neuman's model to assess the 5 variables specific to the client and his stressors, both internal and external. After careful evaluation of her findings, it was discovered the client was experiencing increased stress in his work environment, thus causing him to change his eating habits and blood glucose monitoring habits. Through the use of his holistic approach to patient care, the diabetic educator was able to assist the patient in identifying a problem and developing a plan of care to better meet his needs. The new plan of care involved the patient taking breaks when he felt his stress level rising. By removing himself from the stressors, his stress level decreased, his blood glucose levels decreased, and his food intake decreased. Neuman's systems model can also be used to guide nursing practice for a large organization. Allegiance Health is a 411-bed health system in Michigan that implemented this model into their organization's nursing practice. This health system's goal was to incorporate the model into their philosophy, standards of care, and electronic medical record system. Using Neuman's model, they developed 6 questions to incorporate into their nursing admission database. The questions were: what is your major health problem? Has this ever happened before? How does your ability to function differ from before you came to the hospital? What level of independence do you hope for yourself? What can you do to help in your care? And what can caregivers, family, and friends do for you? Incorporating a massive change within a health system is no small feat. This was a multi-year project that required extensive planning, educating, and evaluating. The goal of implementation of this model was to decrease length of stay, decrease readmissions, and increase patient satisfaction. The data available in the text showed an improvement in nursing care scores since implementation, and 73% of the nurses responding to a survey found the Neumann questions helpful. Neuman's holistic approach fit with this organization's mission and goals. Nursing research and evidence-based practice has benefited from the Neumann systems theory. Much of current nursing practice is driven by published research findings. 12 evidence-based practice projects that were part of the Research Approach in Nursing, or RAIN program, used the Neuman systems model. Several of these studies focused on patients and/or family members' perceptions about various health situations. Neuman's model corresponds with the patient intervention comparison outcome, or PICO, approach that is more commonly used in evidence-based practice initiatives. The patient component for both models involves assessment. The intervention component for both would be the same. Neuman's primary, secondary, and tertiary interventions would correspond with the comparison for PICO, and outcomes for PICO would match up with the evidenced section of Neuman's model. This model has also proven helpful in nursing education. In the mid-1990s, Loma Linda University developed a new nursing curriculum using Neuman's model. Each course and year of study was designed to improve on the student's knowledge. Beginner students are focused on the individual as the client, and each year the students increase to include families and communities. This model helps nursing students to understand there is more to nursing than just caring for one specific patient. An integral part of understanding nursing is realizing there are many definitions for a client, and it is necessary to look at the client as a whole in order to truly understand and meet the needs. The nursing program at Anna Maria College have also used Neuman's systems model as an approach to curriculum development. The School of Nursing considers a student as the client, so the curriculum is developed with the plan of meeting the needs of the students, such as physiological, psychological, sociocultural, developmental, and spiritual variables. The courses are designated into three groups: primary prevention as intervention, secondary prevention as intervention, and tertiary prevention as intervention courses. By designing the program in this manner, the courses build on the students' knowledge, thus improving on their skills, strengthening their lines of resistance, and preparing them for the real world of nursing and healthcare. The methodical approach to teaching nursing ensures that all the students' needs are met and that they will develop the skills needed to be successful nurses in any setting. Neuman's systems theory resonates in many areas of nursing. Since the model's inception in 1972, it has been successfully incorporated in nursing practice over and over. No matter the setting, if Neuman's model is followed, then thorough and holistic assessment of the client and environment will have been conducted, thus the appropriate diagnosis, goals, and outcomes can be established so that the end result will be a positive experience.